Hi, my name is Lorna Mattern, and I'm the Executive Director of United Counseling Service. Welcome to UCS Presents Wellness Moments. Wellness Moments are talking to a content expert about a topic that's relevant in just about 15 minutes. And today I'm here again with Katie Aiken, who's an outpatient clinician working in the Blueprint offices, which is providing mental health services in our primary care offices in our community. So welcome, Katie.
Thank you.
And today we're talking about suicide and suicide prevention. In part, we thought that it was a good topic to talk about because it's Suicide Prevention Month. But the other reason why we also thought it would be important to talk about it is that we've seen a rise in suicide and suicide attempts nationally and certainly in Vermont. And I'm wondering if you can talk a little bit about why that might be, Katie.
Sure. Thanks for having me. Suicide is definitely one of those taboo subjects, and the less that we talk about the subject and really getting it out there and normalizing talking about mental health and mental health wellness, it really leads to those continued stigmas. And one of the things that's not really as well known is that many people actually struggle with these thoughts, but unfortunately they're doing it in silence, because it's not something that they're feeling very comfortable talking about, or even how they share it with someone. Right. So when we think about Vermont specifically, the statistics has definitely risen. We've seen over the last few decades, it's definitely increased from 1 in 6 to being right around 1 in 3, 1 in 4 people as the cause of death, especially in younger people in that age group between 18 to 24. It's one of the leading causes.
Yeah.
So the more that we can really decrease these stigmas and teach people how to reach out if they're worried about someone and ways that they can get help, as well as normalizing in general mental health and ways to access that in a way just like they would their regular doctor. People go to their regular doctors all the time without any stigma around that. You certainly wouldn't feel judged talking about a medical diagnosis, and mental health should be the same way. It should be just as normalizing, because we all know they go together. What happens in your mental health affects your physical health, and vice versa, which can certainly lead to these increasing thoughts of suicide. So this is a great month to really highlight this. And talk about what are some of those important things that we want to do when we're trying to help someone.
So talk about some signs and symptoms around suicide and what people might be seeing.
There's certainly some warning signs and some symptoms that we can watch for. Some of them are certainly a little bit more obvious, but some of them can be a lot more subtle. So what we know about suicide is that often it doesn't come without warning. There are some signs, even the most subtlest of signs, that if people aren't really watching for or helping someone through, it can certainly cause, some issues to happen. So one of those obvious signs that we're looking for is if someone talks about wanting to die, talking about not wanting to be here anymore, just wishing they were dead. That obvious talk that people may do. But then there's some other subtle signs, such as if they're withdrawing more than they normally do, if they're talking about having some hopelessness, certainly giving away of possessions that they normally would certainly have not wanted to give away. Substance use increases, that can certainly be a warning sign. But certainly above all, one of the most important warning signs is when we're looking at a sudden change in mood or behavior. If someone's having that drastic change in their mood or behavior, that is a significant warning sign. That certainly, if you're noticing that in someone that you're caring about, then you certainly want to reach out to them and approach the topic and help them get access to help if needed.
Katie, can you talk a little bit about or give an example of what a behavioral mood change might look like?
That's a really good question, because often it can be seen as, someone immediately what comes to mind is someone who's normally able to process through hard times, and with a lot of resilience. And, they're usually acting pretty happy most of the time, pretty well managed, well adjusted to life. But then all of a sudden they seem maybe a little more sad, maybe noticing some depression, some aggression, some increase in anger that's really consistent. And some of those behaviors might be someone who used to really enjoy preferred activities, especially when we're talking about teenagers.
Right.
Someone who used to always be involved in certain activities and now aren't involved in any of those anymore. And they're not replacing it with a different interest. And those would be those sudden changes.
Yeah, I could see how somebody could miss that. That especially if you're talking about a young person, a teenager who could be angry or depressed on any given day just because of their own changes in their life. And it would be kind of an easy thing to miss, I would imagine.
There's certainly some in adolescence, some expected changes that we see, pulling away from family. But when we see that, what we typically also see is gravitating more towards friends. Right. They're replacing that strong family connection with more of a connection with their peer group. But if that young person isn't connecting with anyone and they're not replacing any of those preferred activities, and they're just really isolating and not, spending hours upon hours by themselves. Right. That's when we really want to reach out with our concern.
And so how do you reach out with your concern? How do you approach somebody you're worried about?
So approaching the topic is certainly something that's very difficult for a lot of people. And that's understandable because this is someone potentially that you're really close with and care about. Maybe a child or a sibling, someone that you're loving, you really love. So to take on that subject with them can be very scary. One of the most important things to do when you're looking at how do I approach this with someone that I'm concerned about is knowing what not to do as well. Because knowing what not to do and what to do are two very important things and that are just as important as each other. Right. So one of the first things you want to make sure that you're not doing is acting very hesitant, very panicky, very scared, because that's going to make that person see that very quickly. And it's not going to make them want to open up as much because they can see how scared you are about talking about this. The other thing you want to make sure you're doing is being more of an active listener than you are an advice giver. A lot of times what we see is the more confident you can be and the more that you appear open and willing to take on this conversation, the more they're actually going to a lot of times feel relief to be able to talk about it. If they've been struggling in silence with this for so long, the ability to finally get it out there and admit to how they're feeling can be such a great relief. Yeah. But they're not going to do it to someone who's acting scared, shy, confident. They're not confident. They're not going to want to. So it's definitely important to appear confident, open, let them know you're concerned. And it's also just as important to ask that question directly. Don't be afraid of the question, are you thinking about killing yourself? Because a lot of times dancing around that question can leave it unanswered.
Yeah. What a scary question to ask, though, isn't it?
It is. It's an incredibly scary question to ask. But the more you can do it, I like to often think about, if you think about a duck on a pond, when you think about a duck, it's very on the pond, just kind of on the surface, gliding across the water. But if you looked underneath that water, those little legs would just be going really, really fast. So it's okay to feel that inside. It's okay to feel like those legs inside, but you want to appear like the duck when you're having that conversation. So always keep that visual in your mind. That's
a great metaphor. It's great to keep in your mind.
One of the best ways to also approach it is to use I statements. Never feel accusatory. Don't threaten. You have to do this or think about how your family would feel. Don't pass judgment. Don't threaten them with anything. Don't make promises you can't keep, and just use I statements. Things like, I noticed, I'm concerned, I'm worried, because, making it about you and seems less judgmental to them.
Yeah.
And less accusatory.
So UCS also offers mental health first aid training, right? And I know that you're a trainer. Is that covered in that training?
It definitely is for both, because one of the great things about this part of the curriculum with mental health first aid is that it teaches you how to ask that question, and it lets you practice that.
Nice.
And then it gives you follow-up things with the answers that you get. Yeah. Because a lot of times if you ask that question directly and you get that yes answer that they are, it can almost feel very paralyzing. Like, what do I do next with this? Yeah. So that training actually helps you move on with what are those follow-up questions, and when is it time to get emergency help, as opposed to just being that support.
Right. And I didn't intend to bring up mental health first aid, but it felt pretty obvious to be able to make sure that folks who are watching or listening know that we offer the training. You can go to our website and see our training dates, and it's free training. It's available to anybody in the community who wants it. And it really just helps you understand what a mental health crisis is and how to respond, not how to treat, but how to respond.
It definitely does. Especially for youth, because a lot of times, as you mentioned, there are so many different things in youth behaviors that we would see as typical. Yeah, right. That are typical adolescents. And then it helps to kind of teach you what are those differences between when is it a potential warning sign and when is it more of a typical adolescent behavior. Right. So that's a really good thing to know. So I've broached the topic, I've talked to the person, and now I'm really worried. What would somebody do next? So one of the things that is important to keep in mind, and definitely you should prepare yourself before you take on this conversation. Never have this conversation with someone when you only have a few minutes, when you're, you want to be in an area that's private. You're not going to want to have this conversation, obviously, in the middle of a grocery store. Or when you have to run out to work, you want to make sure you can devote the time. Right. And you're keeping that confidentiality of that person that you're speaking with. So one of the first things is definitely don't panic. Prepare yourself with information. Be prepared. Even if you don't think that you'll get that yes answer, that they are considering suicide, be prepared in case you are, so that you can practice saying the question and then hearing that yes answer so that you know exactly what to do next. So if you get that yes answer, ask the question, I've noticed, I'm concerned, and state some of those things that you've noticed, that direct examples. And then you can ask the question directly, are you considering suicide? And if they say yes, first thing, don't panic. I know it's extremely scary, but then you're going to want to ask some follow-up questions. Because not everyone who has these suicidal thoughts is actively suicidal. So there's a big difference. Just because someone says, oh, what's the point of going on? It doesn't mean that they're actively suicidal. So it's really important to know that that may not be the next step. You may not be immediately calling 911 in that step. So you want to ask some follow-up questions. You want to ask things like, have you thought about when you would kill yourself? Have you thought about how you would kill yourself? Do you have the means that you would use? Asking those follow-up questions about plan and means and time frame. The more that they answer those questions, and the more immediate it becomes that you need help. Right. So if they do have a active plan, they know when they're going to do it, all of those things, you're never going to want to leave that person alone. You're always going to want to make sure that you're staying with them. And the next most important thing is immediately people think, okay, this means I have to call 911. But that's not always the case. And what's really going to be the most helpful for someone in this situation is to involve them in that decision. So if the person you're with is saying that, yes, they are considering suicide, and they have those means to do it and they know when. You can say to them, I'm really concerned about you and I want to help keep you safe. So we're going to get some help. How would you like that help to come? And know what those options are ahead of time. So the option and so you want to give those options to those people, saying, would you like me to go with you to the emergency room? Would you like to call crisis? Would you like to call the UCS crisis team? Or would you like us to call an ambulance? Would you like us to call 911? We have to do something, but I want to help you decide how that help should come.
Well, I love the fact that it's not like you're giving them a choice for help, right?
Yes.
You're giving them a choice of what kind of help.
Yes.
It's different. Yes. Yeah.
Involving them every step of the way that you can helps empower them. And it helps because some people may have had some bad experiences in the past with certain means of help. So to automatically make that decision for them might actually be more detrimental.
Right.
So to involve them if you can would definitely be the best way.
Now, what if there's some people that can handle those kind of situations better than others. So what if I'm a person that just cannot do what you're suggesting? It's your kid, you're really emotionally involved, you're kind of freaking out, the legs underneath with the duck are now coming to the surface, right? Yes. And you just can't keep it together. What's your thinking there? What's your advice to somebody at that point?
It's certainly understandable that could be the case. It's certainly, and to not feel bad that you can't or judge yourself. It's my child. I should be able to do this. I should be the one doing this. It's not about you at that point. And you have to always keep that in mind. It is never about you. It's about keeping that person safe. So if you feel like you just need more tools or more practice to be able to do it, but you really want to be that person, then reaching out to the suicide prevention line to get more tips and strategies, or to have them walk you through that discussion with them. Or the crisis text line is another great resource. If you just feel like, I don't think I'm going to be very effective with this, it's okay to reach out to the crisis team at UCS and say, I'm really concerned about my child, my friend, my mom, whoever it is. Can you come with me? Can you come to talk to this person? Or if you know someone else that they're really close with, you can share those concerns. Someone that you may feel may be more effective. Maybe you're not effective, but someone else in your family is, that's willing to take that on.
That's great.
It's just important to remember to not just let it go because you don't want to take it on.
Yeah.
And just remember, it's not about you. You don't have to feel guilty. There's many people that just don't feel comfortable being able to take that on, and that's okay. Yeah. The main focus is, finding someone who can. And there are agencies out there that can help you find those people and figure out what the next step is.
And you mentioned a couple of resources that are actually going to be put up at the end of this conversation with phone numbers and contacts. So we'll make sure that information is available. Is there anything else, Katie, as we wrap up, that you want to make sure that you say or let people know about?
I think one of the greatest things that we can really do as a community when we look at Suicide Prevention and Suicide Awareness Month is to take a look at what our own selves and what are those stigmas that we believe about suicide, so that we can really educate ourselves more on what it is and what it isn't. It doesn't mean that, it's something we need to be afraid of taking on that conversation. And the more that we can normalize mental health wellness, the less suicide rates we're going to see.
Right.
And the more help that we're going to be able to give each other as a community. It's really important, especially during times of COVID and isolation and the increased anxiety and that feeling of dread and hopelessness of what's coming next that we're all sort of feeling during this time. It's really important to also take care of ourselves and to take care of each other. So the less that we can consider this such a taboo topic, and the the more that we can really get the word out there and normalize taking care of ourselves and our mental health.
That's great, Katie. I really appreciate this conversation. I know others will too. UCS is here for our community. Please reach out. As I said, numbers and contacts and so forth will be on the screen. Appreciate your time in talking about this really very important topic. Thanks,
Great.
Katie.
Thanks very much.